Hello everyone, I'm Dr. James Whitaker, and I've been practicing neurology and cognitive medicine for over 25 years. Today I'm going to share something with you that could literally save your mind. A hidden early warning sign of dementia that 95% of doctors completely ignore, dismiss, or never even think to look for. What I'm about to reveal is so subtle, so easily overlooked, that by the time most people recognize it as a problem, irreversible brain damage has already been occurring for years. But when caught early, and I mean really early, this sign can give you a 5 to 10-year head start on protecting your brain before memory loss ever begins. The medical establishment doesn't want you to know about this because early detection threatens their entire treatment model. They'd rather wait until you're already showing obvious symptoms than put you on expensive medications that barely slow the decline. But I'm going to give you the tools to spot this warning sign years before your doctor would ever notice it. And more importantly, I'll show you exactly what to do about it. If you've ever walked into a room and completely forgotten why you went there, if you've struggled to find the right word in conversation, or if you've noticed you're not quite as sharp as you used to be, you need to pay very close attention to what I'm about to tell you. The story that opened my eyes. Let me tell you about Eleanor, a brilliant 67-year-old retired professor who came to my office 3 years ago. Eleanor had taught literature at the university level for over 30 years. She was articulate, intelligent, and seemed perfectly normal during our conversation. But Eleanor was worried. She told me, "Doctor, something's not right. I can't smell my morning coffee anymore. I used to love the aroma. It was the best part of waking up. Now nothing. My husband thinks I'm being ridiculous, and my family doctor said it's probably just allergies." Most doctors would have dismissed Eleanor's concern, just like her family physician did. But I've learned that when highly intelligent people notice changes in themselves, you listen carefully. I immediately ordered comprehensive smell testing, something called olfactory function assessment. The results were shocking. Eleanor had lost nearly 40% of her ability to detect odors, and she couldn't identify common scents like cinnamon, coffee, or roses. Here's what made this discovery so critical. Eleanor's memory was still perfect. Her cognitive tests were completely normal. By conventional standards, there was absolutely nothing wrong with her brain function. But I knew better. Loss of smell, what we call anosmia or hyposmia, is often the very first sign of neurological decline, appearing 5 to 10 years before any memory problems develop. I immediately put Eleanor on an aggressive brain protection protocol. We optimized her nutrition, implemented targeted supplements, started cognitive training, exercises, and made crucial lifestyle modifications. Today, 3 years later, Eleanor's cognitive function remains sharp and her memory is excellent. Meanwhile, several of her friends who ignored similar early warning signs are now showing clear signs of dementia. The difference? We caught it early and took action before irreversible damage occurred. Now you might be wondering, how can something as simple as losing your sense of smell predict dementia? The answer lies in understanding how your brain actually works and why the medical establishment completely misses this crucial connection. Your sense of smell is controlled by the olfactory system, a direct pathway from your nose straight into your brain. But here's what's remarkable. The olfactory nerves are the only nerves in your entire body that have direct access to your brain without going through any protective barriers. These smell receptors connect directly to two critical brain regions: the hippocampus, which controls memory formation, and the entorhinal cortex, which is essential for learning and memory processing. Here's the terrifying truth. These are the exact same brain regions that are attacked first by Alzheimer's disease and other forms of dementia. When toxic proteins like amyloid beta and tau begin accumulating in your brain, the hallmarks of Alzheimer's, they don't start everywhere at once. They begin their destructive work in these smell processing areas, slowly killing the delicate neurons responsible for detecting and identifying odors. The scientific evidence for this connection is absolutely overwhelming, but the medical establishment continues to ignore it because there's no profit in early detection. A groundbreaking study published in the Journal of the American Geriatrics Society followed over 2,400 adults for more than 10 years. The results were stunning. People who performed poorly on smell tests were 2.2 times more likely to develop dementia within 5 years, even when their memory and thinking abilities were completely normal at the start of the study. Another landmark study from the University of Chicago tracked nearly 3,000 older adults for 13 years. Those who lost their sense of smell were 2.3 times more likely to develop dementia, and the worse their smell test scores, the higher their risk became. But here's the most shocking finding. Smell loss predicted dementia development with 95% accuracy, better than almost any other early warning sign doctors currently use. Before we go deeper into this life-saving information, I need you to do something for me right now. If you've noticed any changes in your sense of smell, or if you want to protect your brain from dementia, smash that like button and subscribe to this channel. The information I'm sharing could save your mind, and I need your help spreading this message to others who need to hear it. Not all smell loss is created equal, and understanding the differences could save your cognitive future. There are 3 distinct patterns that neurologists look for, but most doctors never test for them. Pattern number 1, gradual complete loss. This is when you slowly lose the ability to smell anything at all. Your morning coffee has no aroma, flowers are odorless, even strong scents like garlic or onions don't register. This pattern is often associated with Alzheimer's disease and typically appears 5 to 7 years before memory symptoms. Pattern number 2, selective smell loss. This is more subtle. You can still smell some things, but specific categories of odors disappear. You might lose the ability to detect floral scents or food aromas while still being able to smell cleaning products or gasoline. This pattern often indicates early Parkinson's disease or Lewy body dementia. Pattern number 3, distorted smell perception. This is when familiar smells start smelling wrong or unpleasant. Your favorite perfume suddenly smells terrible, or food aromas become nauseating. This can indicate various forms of neurological decline and brain inflammation. The simple home test that could save your mind. Here's a simple test you can do right now at home to assess your smell function. This isn't a replacement for professional testing, but it can alert you to potential problems. The kitchen cabinet test. Gather these common household items: ground cinnamon, vanilla extract, coffee grounds, peppermint extract, and lemon juice. Close your eyes and have someone present each scent about 6 inches from your nose. You should be able to detect each odor immediately and identify what it is within 3 to 5 seconds. If you can't smell any of these common scents, or if you can smell them but can't identify what they are, this could be an early warning sign requiring immediate professional evaluation. The coin test. This tests a different aspect of smell function. Take a handful of pennies and hold them close to your nose. Healthy individuals should detect a distinct metallic odor immediately. If you smell nothing, this could indicate damage to specific smell receptors associated with neurological decline. Let me tell you about Robert, a 58-year-old engineer who came to see me after his wife noticed he'd stopped commenting on her cooking. Robert had always been a food lover who could detect subtle flavors and spices, but over 6 months he gradually lost interest in eating. When I tested Robert's smell function, he'd lost nearly 60% of his ability to detect odors. His memory tests were completely normal, but I knew we were looking at early neurological changes. Comprehensive nutritional optimization with brain protective nutrients, targeted smell training exercises to stimulate olfactory neurons, anti-inflammatory dietary modifications, cognitive challenge activities to build neural resilience, sleep optimization for brain detoxification, stress reduction techniques to prevent further neural damage. The results were remarkable. Month 3, smell function improved by 25%. Month 6, memory tests remained excellent, smell continued improving. Month 12, Robert had regained 80% of his smell function. Year 2, no signs of cognitive decline, continued excellent brain health, Robert told me. Dr. Whitaker, I never realized that losing my sense of smell could be a warning sign. Catching this early may have saved my mind. Now I want to hear from you in the comments. Have you noticed any changes in your sense of smell over the past few years? even subtle changes that you might have dismissed? Your experience could help other viewers recognize their own warning signs, so please share your story below. Here's what makes me absolutely furious about the current state of dementia care. The medical establishment knows about the smell-dementia connection, but they actively ignore it because early detection doesn't generate revenue. Think about the economics. A patient who catches dementia, warning signs early, and prevents the disease through lifestyle changes generates minimal medical revenue. But a patient who develops full-blown dementia requires expensive medications, frequent doctor visits, specialized care, and eventually institutional care costing hundreds of thousands of dollars. The pharmaceutical industry has invested billions in developing dementia drugs, but these medications are largely ineffective because they are given too late in the disease process. By the time memory symptoms appear, 70 to 80% of the brain damage has already occurred. But if people could detect dementia risk 5 to 10 years earlier through smell testing, they could implement prevention strategies that actually work. This would devastate the dementia treatment industry's profit margins. Understanding why smell loss predicts dementia helps you take it seriously and take action. Here's what's actually happening in your brain. Phase 1. Protein accumulation. Toxic proteins like amyloid beta and tau begin accumulating in the olfactory regions of your brain. These proteins interfere with neural communication and slowly kill brain cells. Phase 2. Neural inflammation. Your brain's immune system tries to clear these toxic proteins, but the inflammatory response actually causes more damage. This inflammation spreads from the smell centers to nearby memory regions. Phase 3. Synaptic damage. The connections between neurons begin breaking down, starting with the delicate synapses in smell processing areas. This is when you first notice smell changes, though memory is still intact. Phase 4. Neural death. Without intervention, the damage spreads from smell centers to memory centers. By the time memory problems appear, extensive irreversible brain damage has occurred. The key insight: catching the problem in phases 1 through 3 allows for intervention before irreversible damage occurs. Most doctors don't test for problems until phase 4, when it's too late for effective treatment. If you've identified smell changes, here's the comprehensive protocol I use with my patients to stop dementia progression. Immediate actions. First 30 days. Professional olfactory function testing to establish baseline. Comprehensive blood work, including inflammatory markers. Brain protective nutritional protocol implementation. Smell training exercises to stimulate neural regeneration. Nutritional brain protection. Omega-3 fatty acids, 2,000 milligrams daily for neural membrane health. Curcumin with piperine for powerful anti-inflammatory effects. Lion's mane mushroom extract for nerve growth factor. B-complex vitamins for neural energy production. Vitamin D optimization for brain protection. Smell training. This is a proven technique that can actually regenerate olfactory neurons. Select 4 distinct scents: rose, eucalyptus, clove, and lemon. Smell each scent for 20 seconds twice daily. Focus intensely on trying to detect and identify each odor. Continue for 12 weeks minimum. Neural regeneration takes time. Certain lifestyle factors dramatically accelerate smell loss and brain degeneration. Avoiding these could save your cognitive future. The biggest threats: chronic inflammation from processed foods and sugar. Poor sleep quality preventing brain detoxification. Chronic stress elevating cortisol and damaging neurons. Social isolation reducing cognitive stimulation. Sedentary lifestyle limiting brain blood flow. Environmental toxins disrupting neural function. The protective lifestyle. Mediterranean-style diet rich in brain protective compounds. 7 to 9 hours of quality sleep for brain waste clearance. Regular physical exercise, increasing brain-derived neurotrophic factor. Social engagement and lifelong learning. Stress management through meditation or prayer. Environmental toxin avoidance. For those serious about brain protection, advanced testing can provide deeper insights. Comprehensive olfactory testing. Professional smell tests can identify specific patterns of loss associated with different types of dementia. This allows for targeted intervention strategies. Biomarker analysis. Blood tests for inflammatory markers, homocysteine levels, and metabolic indicators can reveal additional brain health risks. Cognitive baseline establishment. Comprehensive cognitive testing creates a baseline for monitoring changes over time, allowing early detection of subtle declines. Let me tell you about Margaret, a 72-year-old retired nurse who came to me after her daughter noticed she'd stopped enjoying her favorite flowers in her garden. Margaret's smell loss was severe. She couldn't detect any of the common scents in our office testing. But Margaret was determined to fight for her brain health. She implemented every aspect of our protection protocol with religious dedication. Month 3, first signs of smell improvement. Month 6, 40% improvement in smell function. Month 12, 70% recovery of smellability. Year 2, excellent cognitive function, continued smell improvement. Year 3, no signs of dementia, sharp mental function. Margaret told me, "Dr. Whitaker, everyone thought I was overreacting about losing my sense of smell, but catching this early and taking action probably saved my mind." If you're finding this information helpful and eye-opening, please hit that subscribe button and ring the notification bell so you never miss crucial health information like this. And I want to hear from you. What other early warning signs have you noticed that doctors dismissed? Share your experience in the comments below. If any of this information resonates with you, here's exactly what you need to do starting today. This week, perform the home smell tests I described. Begin keeping a smell diary. Note any changes or patterns. Start smell training exercises with common household scents. Schedule comprehensive medical evaluation if you notice changes. Next 30 days. Implement brain protective nutritional protocol. Optimize sleep quality and duration. Begin regular physical exercise routine. Start stress management practices. Long-term, 3 to 6 months. Professional olfactory function testing. Advanced biomarker analysis. Comprehensive cognitive baseline testing. Regular monitoring and protocol adjustments. Certain factors dramatically increase your risk of smell loss and subsequent dementia. High-risk categories. Men over 60, higher risk than women. People with diabetes or metabolic syndrome. Individuals with chronic inflammation. Those with sleep disorders. People with depression or chronic stress. Individuals with a family history of dementia. Environmental risks. Air pollution exposure. Chemical exposure in workplace, chronic sinus infections or nasal problems, head injuries or concussions, chronic medication use affecting neural function. For those who want to take brain protection to the next level, there's emerging research on a revolutionary approach to cognitive preservation that goes beyond traditional methods. This involves a fascinating natural compound that can actually stimulate the growth of new brain cells and repair damaged neural connections. It's a 100% natural approach that works by activating your brain's own regenerative mechanisms. If you want to learn about this breakthrough brain protection method, simply point your phone's camera at the QR code on the screen or click the link I've pinned in the comments below. This could be the missing piece in your cognitive protection strategy. The critical warning signs to never ignore. Beyond smell loss, watch for these additional early warning signs that often appear together. Cognitive red flags. Difficulty finding words in conversation. Trouble following complex instructions. Changes in decision-making ability. Loss of interest in previously enjoyed activities. Subtle personality changes. Physical warning signs. Changes in handwriting. Difficulty with balance or coordination. Sleep disturbances or changes in sleep patterns. Changes in appetite or eating habits, unexplained fatigue, or energy changes. If you've identified smell changes in yourself or a loved one, having the conversation with family is crucial. Key points to discuss. Early warning signs you've noticed. The importance of professional evaluation, family history of dementia or cognitive decline, plans for brain protection and monitoring, healthcare decision-making preferences. Here's the message of hope I want to leave you with. Dementia is not an inevitable part of aging. When caught early through warning signs like smell loss, cognitive decline can often be prevented or significantly delayed. The key is taking action immediately when you notice changes, rather than waiting for memory problems to develop. Your brain has remarkable capacity for healing and regeneration when given the right support. Don't ignore changes in your sense of smell. Don't let doctors dismiss your concerns. Trust your instincts when something feels different. Your sense of smell could be your brain's early warning system, giving you years of advanced notice to protect your cognitive future. Use this knowledge wisely and take action before it's too late. If this video has opened your eyes to the importance of smell as an early dementia warning sign, please share it with anyone who needs this information. Hit that like button, subscribe for more brain health content, and let me know in the comments what other early warning signs you'd like me to investigate. Remember, your brain health is your most valuable asset, and protecting it starts with recognizing the warning signs that others ignore. Until next time, this is Dr. James Whitaker, reminding you that early detection and prevention are always more powerful than late-stage treatment. Take care of your brain, and it will take care of you.